Good day, I'm John. I'm currently working at Wellington Regional Hospital and I'm studying at Toy Oromai Institute of Technology. Before starting here at decontamination area, we perform hand hygiene at least for 60 seconds and then dry it well with clean towel. Now I first put on a shoe cover since these are the first to have common contact. Next is I put on a full body gown that covers my arms and legs. Then I put a mask that protects from respiratory protection and full coverage against aerosol and splashes. Finally, putting 2 layers of gloves with nitro gloves as the first layer and the high-risk latex gloves as the outer layer for added protection. And lastly, check all PPE is fitted properly before starting. This is where normally the nurses leave the trolleys with RMDs we process. This is a major set. We usually use a jewelry box that we use for loose and sharp instruments. Now I'm sorting the instruments by spreading the forceps alternately and open a joint box to make sure the joint box are getting clean. While pre-rinsing the instruments, I use a brush to make sure to clean them from any debris. After the cleaning process, I move the instruments to the ultrasonic cleaner as this is designed to remove soil from hard-to-reach areas. Now the ultrasonic is finished, I place the instruments on the trolley. I make sure to check the spinner is not hitting anything. Once everything is in proper place for cleaning, the instruments are transferred to the washer disinfectant. Proper removing of PPE is I start removing my shoe cover while still wearing gloves. Then remove my gown and gloves, and finally remove my face mask. I finish it with hand hygiene to ensure full protection. Now we move to the packing area. As I perform a hand hygiene, I use a sanitizer to ensure my hands are clean. We can begin tray setting as I check the instruments are dry, so I use a liner or cloth to dry them out. Once it's dry, I sort and place the tray for setup, and I start on consulting the checklist while visual checking of each of the instruments to ensure that the tray is complete. As I inspect each instrument for their functional, if it's not stiff, and check for cleanliness, especially the hinges and tips are free from contamination. As I finish setting up, by including type 5 internal indicator, this provides assurance that the sterilization cycle condition has been met. Once everything is in order, I prepare the instruments for wrapping. I place a liner at the bottom of the tray to prevent from getting wet, and start wrapping and finishing to put the checklist on the top with type 1 tape indicator, which changes colors after sterilization. Next, we move to the sterilization. At this stage, we perform a manual handling, so we must be cautious on our movement, especially on moving heavy instruments. We must bend our knees when putting instruments at the bottom of the trolley to place the wrap in a proper handling by not sliding them into the trolley, because this may damage the integrity of the instruments. At this stage, we scan TDoc and database of all the instruments. This will allow us who is responsible and accountable to this process. We place a GKE in every cycle that we do. After all the documentation and placing a batch number, it is now ready to be sterilized in our autoclave. After the sterilizing door is closed, I move the trolley in the other side and ensure the trolley is secured by locking the wheels. When the cycle is complete, I unlock the trolley and wear heated resistant glove. After unloading, I move the trolley to the cooling side to allow the instruments to cool down. This takes 30 minutes to cool down. As part of the load release, I check the GKE if it changes color, and I pass Bovidic test, then place it in our documentation. I also review the information on the printout, including the sterilizer number cycle number, sterilization, and drying temperature to ensure the cycle is a pass. I sign my name on the printout and the load release form for accountability. This documentation has to be second signed by other technician to check the parameters has been met. Here is a quick view of our sterile storage area, where all instruments are considered sterile. Hands must always be clean. When moving loads, always lock the trolley wheels for safety purposes. Now it's time to place our instruments on its proper locations. I carefully move the shelves to create space for me when putting down the instruments on each location. Here is a short clip on what is actually on each shelf and its proper place of storage, where each shelves are clearly labeled for easy identification.